So thank you so much for being here today. This is Dr. Ann J. She is a neuroradiologist specializing in head and neck imaging at MedStar Georgetown University Hospital. In addition to many other things that I'll go into briefly, but she is an associate professor with dual appointments in the departments of radiology and otolaryngology. At MedStar Georgetown University Hospital, she serves as Vice Chair of Education, Program Director for the Diagnostic Radiology Residency Program, and Division Chief of Neuroradiology. She also is very much involved with Georgetown University School of Medicine, and she's passionate about diversity, equity, and inclusion, and is co-director for the new DEI Longitudinal Scholar Track. She was also selected as lead coach for the Bias Reduction and Improvement Coaching inaugural class, and is a member of the Racial Justice for Committee for Change. She's published many papers in many great peer-reviewed journals and has won various teaching awards, among Best Teacher of the Year. Her medical degree is from the University of Virginia in Charlottesville. She completed an internship in internal medicine at MedStar Washington Hospital, and then did her diagnostic radiology residency also at Georgetown. She then went into a 2-year neuroradiology fellowship at the University of Pennsylvania, where she stayed on as faculty before coming back to Georgetown University as staff there now. So it is with, I'm very honored to have you here today. Sorry for the technical difficulties. And I'm going to hand it over to you. Thank you again.
Great. Thank you so much, Daryl. Thank you so much for inviting me to speak today. And thank you for the SIR RFS for also inviting me. So I love that I get to speak about failure, so that if I just completely bomb this lecture altogether, I am still setting up myself for success by setting the bar pretty low. So I have no disclosures. The goals of today are to explore what failure looks like in residency, discuss what grit and resilience are, and then learn about ways to become more resilient, because it is a learned skill. We all know what failure is, right? It's a lack of success, not achieving our goals, of falling short, and the inability to perform a normal function. Like if you're a kidney and you're failing, you're not doing your normal function. But I think all of these sound pretty dramatic and are really not a part of most of our lives. Most of us don't have or see this complete lack of success in anything we do, really. So I feel that it's more of a falling short that is a more relevant definition, whether it's falling short of our expectations, other expectations, or goals. Resilience then is to be able to recover from this lack of success or achievement, or easily adjust to misfortune or change or any sort of challenges that come through our life. So when I was doing research into failure, much of the literature is really based out of the business world, right? And I felt, that these failures that they were talking about really didn't resonate with me or our profession as physicians, really. I mean, sure, we will have, failed projects, rejected ideas, failed promotions, etc., that will be a part of the lives of physicians. But I feel like, the progression of our careers are much more stable than those in business, and that our goals are not hinged on this constant cycle of projects or trying to reinvent ourselves in order to pitch ourselves for the next best gig, right? We don't really see put all of our years work in trying to get a business started and then having it fail. This just doesn't really resonate with us very much. So I wanted to think about what failure meant in the lives of physicians, and particularly in the lives of people like you, who are trainees in this weird hierarchical world of medicine that we live in. And as someone who has been in your shoes and someone who is program director, I feel like this feedback can be very devastating to receive, especially since, radiology is a pretty competitive residency to get into. And so, most of you guys have gone through, medical school doing really well and really only hearing positive, feedback about how, how well you excel and how much you're getting concepts and et cetera. So it's really hard then to come into radiology residency, right? Everyone goes through that first year kind of like, oh my God, what have I gotten myself into kind of phase where you have no idea what's going on. You feel like you don't know anything for the first time, and it's like drinking from a fire hose. And then on top of that, you hear, you know what, you're really not doing as well as, your expected level. Your average, your fund of average is below level what we expect it to be. Your reports need constant correcting. You need to pay attention to this. You didn't put the amount of contrast in. When you're taking call, your mistakes are higher than we would expect for someone at your level, or you're making these mistakes that we wouldn't expect. So all of this is really difficult to hear, especially is for most of you, it's going to be for the first time. And then also, we don't live in a vacuum, right? Residency is not the only thing that fills your entire life. Like, life happens, and unexpected stressors are invariably going to happen, right? And this is especially true, with COVID. Many of us have seen people get sick. Our family members get sick. People are, in our own personal physical and mental health issues have come up. Maybe your relationship has ended, et cetera. So there's a lot of things that happens on top of that. So, when the stresses of radiology and the stresses of life collide, it's just absolute chaos. And here you are with this single little rope trying to pull and trying to survive this. And you feel like, oh my God, it's too much. But I will say that, chaos is okay. It's going to happen, right? But the danger, I think, is allowing yourself to stay in that chaos. So I think this is a very natural human, like, first reaction to have when something bad happens. Like, why me? Why is this happening to me? Why is my program director picking on me? Why is his attending like riding me today? Why are they being so hard on me? I've really done nothing wrong. And I'm not going to invalidate these feelings at all. I don't think, to be honest, you should never invalidate your own feelings. You feel what you feel, and then you can kind of mull over it later. But if you feel things, don't try to repress them. I think that's a little bit more dangerous. This feeling of why me has certainly come up for me, and I'm sure for everybody that's on this webinar today. But the danger of focusing on this is that you assume that you deserve better from the world, that because of whatever goodness that you think that you put into the world, that you are entitled to escape the chance misfortunes that happen in life. That you think that the world owes you something better. And on the flip side of this, that, we all know that bad things happen randomly to people, right? And so why is it acceptable and like, oh, that's too bad when it happens to somebody else, but then it's not okay when it happens to you, right? So we're all fair game in this. And if you take out the entitlement that you have over somebody else, that bad things should happen, not to you, but to somebody else, that's sort of like it's not a healthy mindset, I think. And so instead of asking the question of, why me, then maybe a better question to ask is, why not you, right? Why, yeah, like I said, why is it that someone else should be, have the misfortune and you should not? The other aspect of this why me question is the assumption that you're completely removed from fault and that you lack agency over your life. So instead of saying that it is so unfair to me that this attending is being so tough on me today, maybe, maybe who knows what the circumstances are, maybe they're being tough on you, but maybe the whole thought of being unfair is really not realistic. Reflection, I think, is the most important part of all of this kind of sanity process, right? And understanding, not blaming somebody else, but really, reflecting and thinking about what your part has been, right? Maybe admitting to yourself that you were wrong, or maybe you were, you're not, your fund of knowledge is not where it's supposed to be. That's a really hard pill to swallow, but a really good exercise to do, because that's really the only way that you're going to grow. Another danger of staying in this chaos is drowning in despair and not taking care of your mental health. This is a really important danger. There is a really high percentage of physicians dealing with mental health issues, and we have a higher rate of suicide than the general population. But despite recognizing that they have depressive or anxiety symptoms, more than half of physicians will not seek out mental health care. That's a problem because we have a job that demands so much of our cognitive and emotional energy. And if those energy stores are constantly being depleted by, depression and anxiety, eventually something is going to break. Talk to somebody. Most institutions now realize that this is a really big problem among physicians, particularly when, when COVID hit and the pandemic kind of put everything into chaos. And many institutions are likely going to offer free and confidential counseling. I think it's important, and I would tell you that coming from an Asian background where a lot of Asian cultures really don't believe in mental health issues, and they think that you can just power through depression and anxiety or power through, psychosis. You can't, right? It's an illness just like, breaking your leg is. So you really sort of need to change your thinking about what you can do with mental health. And fortitude just won't get you over depression and anxiety. And also, I think a lot of times, people are like, well, I've never had this issue before, so it's probably just a situational thing where I'm just, going through a rough patch, I'll be okay. But I think, residency in medical school brings up a lot of new challenges and situations where, these things may come through, and maybe it's not going to be permanent, but it's worth it for yourself to kind of explore that. It just never hurts to ask. You may talk to a counselor and they say, you know what, you're actually fine. But it's worth asking an objective professional about what they think, because certainly we cannot be very objective about our own health. I always tell residents, like, I love therapy. Therapy is, it's awesome. It's not because you're weak that you need therapy. It's just, I feel like it just means that you're tuned enough with your emotions, that you are aware enough that you realize you need to kind of, suss everything out, and you need somebody else's opinion on something. Another related danger of staying in this chaos is being overwhelmed with imposter syndrome. Thinking that, IR is such a competitive residency to get to. Like, how did I get here? I got here by sheer luck. Someone, this attending put in a good word for me. He knows this person, and so that's the only reason why I got in, and not that you really deserve it. And this concern, like, oh my God, they're not going to think, they're going to find out that I'm not as smart as they think I am. This is a really anguishing feeling, and it creates a lot of noise in your head. I remember, I used to have these huge sympathetic surges when I would have to take an unknown case in case conference during residency. And all I can do is like hear the heartbeat in my head, and I can just feel myself flush. And I think about, oh my God, everyone can see that I'm so nervous, that I know what I'm doing, that I'm stupid, et cetera, et cetera. And like how can anybody think clearly with all of that like physical and mental commotion happening? It's really impossible. But I think the most important danger of languishing in failure is forgetting what your goal is. It's important to stop and recenter and remember why you are here to begin with. Why you started on this long and arduous journey. Was it to be, the smartest person in your class? Was it for the sort of, pomp and circumstance of becoming a physician? Was it to get through training and finally be independent and make money so you can start your life? Was it to, kind of sail through residency, be just good enough to meet expectations, not ruffle any feathers, not get called into the principal's office? Or was it to become the best doctor that you could be for your patients? I think it's so easy for us to forget why we are here. That sometimes the struggles that seem to be sort of unending, wear us down, so that we switch which race we're running in and jump into the sprint lane and try to get just through residency instead of staying steady in the marathon of becoming the best doctor you can be. You know, it's not about just getting through training. That is not your goal. It's about knowing that every day completed training is a day closer that you are, closer to when you will be caring for your patients alone. So at the end of training, when all the days are ticking by, have you set yourself up to be the doctor that you hope to be someday? And have you set yourself up to be the doctor that you would trust treating your loved ones? And if the answer is no to both of those, then you might want to sort of consider sort of pivoting and sort of rerouting the path that you are on. We know that these past 2 years have just been extraordinarily difficult. Residency is supposed to be about intense learning experience, but it is also supposed to be about a time of tremendous growth, both career-wise and personally, connection, and fun. The New York Times even had a podcast about how we have been languishing in this unending blah feeling because of the pandemic. So I don't want to undermine or lessen this experiencing that you guys are having. The pandemic has either defined half or all of your residency. It's a really difficult time and environment to learn, to feel connected, and to feel like you're thriving. So right now, the chaos may be overwhelming, right? Everything is going on. And then on top of that, you've got the pandemic, you can't connect, Delta's coming down. So now all the hospitals are shutting down again and going back to, in the height of COVID restrictions, et cetera. But we're all kind of in this together. All right, so I know this sounds like, oh my God, and something is gonna burst, but I just wanna give you some tough love right now and say, get a grip. Okay, first feel your feelings. Just feel them. Don't try to repress them or whatever. Just feel them and know that you're okay. If you are angry, if you are sad, if you want to go boxing or whatever, it's okay. Feel your feelings. If you have no insight at all into how you are feeling, you will never be able to rear them in at all. Then know that that whatever failure or shortcoming that has happened, that is not a permanent situation. And the intensity of the bad feelings you have will get better. Know that in residency, we expect you to not get it right all the time. That's why there are many safeguards in place. We would never sacrifice patient care for resident education purposes. There's this really great advice that I got from a pediatrics surgery attending one time when I was on call, and I was perseverating on whether or not to call positive appendicitis or not on the CT case. And the reason for that was wrong. I was like, oh, if I get it wrong, I'm going to get in trouble by the attending the next day. But he was so gracious, and he told me very nicely that he's like, you know what, Anne, ultimately, I really don't care what the interpretation of a CT scan is from a second year resident. Like that's helpful. It can be helpful, but ultimately, like I am the attending. And I will make my decision on managing this patient based on what I see, the patient, the physical exam, the labs, whatever. He's like, your radiology read is fine, but whether you call it yes or no, or I believe whatever that is, he's like, it doesn't make a difference. Like, I'm going to treat the patient based on the patient, not on this one piece of information. So know that, we should all try our best, of course, for every single patient, but know that everyone makes mistakes. And especially in residency, we have these safeguards in place so that you will hopefully not make a fatal error. The other really good exercise I do is I ask myself all the time, who do you think you are? Like, who do you think you are that you think you're too perfect to make a mistake? If I'm really sort of down about something that I've done or whatever, who do you think you are when you feel like I'm miffed by somebody? Like, who do you think you are that, they can't, challenge you or disagree with you? Who do you think you are? I feel like this question puts my feet back on the ground, because in the end, we have all traveled the same road, or you guys will eventually travel the same road I have. And lastly, the feeling of failure and imposter syndrome can be very overwhelming. And so I tell this to the medical students as well, like, why, ask yourself, like, why you assume that people even think about you. Because I would tell you, the last thing I'm going to do after coming home after a long clinical day, putting my kids to bed and sitting down and having a glass of wine with my husband is, geez, that resident really gave a bad answer during conference. What? I promise you that that me nor anybody else that was in that room is not thinking about that. Neither do they care, right? So if you understand that everybody is too preoccupied with thinking about themselves, and they could care less about you, you kind of take away the power from being embarrassed by them, because they don't care, so you shouldn't care. So the other thing you need is some grit. So for those of you who know me, grit and hustle are my two favorite words. The psychologist Angela Duckworth defined grit as having passion and the perseverance for very long-term goals. And what could be longer than training for a radiologist, than to be a radiologist, right? We do at least 6 or 7 years of training after medical school and 11 years after college when you include medical school. So it's about showing up every day, day in and day out, in the dogged pursuit of your goal. So remember, it's not about just working hard and kind of doing the same thing over and over again, even though you're failing. It's about not giving up. So then the important parallel to have with grit is resilience. And this is the ability to recover from adversities and obstacles you may have along the way. So we're all going to fall on our journey. But resilience is being able to learn from our falls and make adaptations to go forward as we stand up. So I recently listened to a really great TED Talk by David Donaldson about resilience. And he talked about how resilience is a higher functioning task that needs the neocortex, or the more newer and more sophisticated part of our brains. The amygdala, on the other hand, is part of our primitive brain, and it's very reactionary, right? It's the part that's responsible for our fight or flight response, which evolutionary-wise was very useful, right? But now, it's still there and still used for the same purpose, but instead of being used to run away from animals to prevent being eaten, it's used for when we stress about any sort of stress that comes into our lives, and we have sort of emotional trigger about it, right? So if you are highly anxious about performing poorly on a biopsy, you feel like you're doing well, and you are getting that sort of really big response, then that's your amygdala, kind of what they say, amygdala hijacking your brain. The thing about the neocortex, though, is that it uses a lot of energy, and your amygdala uses low amounts of energy. So when you're in a very stressful situation, your brain is going to have a natural tendency to use the lower energy using amygdala. But the good news is it's not, that you can train your brain to be more resilient and to call on the higher energy using neocortex. So we talked about the 7 muscles of resilience that was developed by a psychologist, Linda Hoops. So we're going to kind of talk about these individually. First is positivity. This is kind of like the look for the silver lining in a bad circumstance, right? It's really sort of believing in your core that failure is not permanent, but that you can probably do something about the situation to make it better. Whether it's the outcome, or maybe you can't do anything about the outcome, but you can change your perception about the situation to lessen its emotional burden on you. However, you need to be careful about false positivity. We really live in a culture that is pathologically obsessed with positivity and how perfect life is, and this is obviously perpetuated by social media. And listen, I have my gripes about social media, but I also think it's great. But we know, and we also have to constantly be aware that people use very carefully curated profiles to give this perception of, to give their image perception that they want you to see when that is not real life, right? And I will say, and not to be like a dream burster or whatever, all those inspirational quotes say, you can do anything you want to do if you put your mind to it. I mean, if you really think about it, that's like not really true. Like, there are a lot of things that I would love to have the skill to do, and even if I really put my mind to it, it's going to be not the most successful endeavor. So my kids are I'm a full-on dance mom, and so I joined the competitive parent hip hop team, and I will try. I really want to be a hip hop dancer, but despite how hard I try, it's just not going to go well. So leave that false positivity at the door, and instead focus on being positive, that your setbacks will get better. But sometimes that better means that you may completely have to pivot onto a different path instead of continuing on the path that you're on. Confidence is knowing that what your strengths are, and that you can rely on your strengths to make things better. So, where do you find your validation? Think about that. Make sure that your validation is, rooted deeply in meaningful relationships that cannot dissipate by a single post online, or even, losing your job or not getting a promotion. That's really important. Are things that can be temporary. Believe that you can make the situation better. As much as it takes, you need to use reflection to reflect about your weaknesses. It also really helpful to reflect and understand what you believe your strengths are. So remember that ego is fragile and is based on what others think of you, but that confidence is grounded and is based on what you think of yourself. Take time to think about what your priorities are. You're not necessarily your day-to-day priorities, like go to the gym, cook healthy dinner, etc., but your long-term ones. Are you giving the effort you need to become the doctor you want to be? Do you have the grit to show up every day, even though sometimes you may not want to? Be creative and think outside the box for ideas on how to adapt to challenges. Be okay with trying new ideas that may not have clear or predictable outcomes. To me, this means not being rigid in your determination to follow your original plan. An example that I can think of is that a lot of times when residents come into radiology residency, they're very successful students because they've been able to create a very effective studying mechanism or studying plan when they were in medical school. But when you get to radiology residency, it's a really different ballgame, right? You have to develop your eye. You have to you're like, okay, do I look at the pictures, or I memorize that, or do I, read all this stuff and what they're supposed to look like, and then how do I merge them together? And so I have found that the radiology residents who are so rigid in studying the way that they are in medical school, even though it's not working for them, tend to have more difficulty than people who say, okay, it worked great for me in medical school, but I need to completely abandon ship and try a different way because it's not working for this. So not being rigid it can be very helpful. On the flip side, you also need to have an unambiguous plan for accomplishing your goals. You just can't willy-nilly jump into situations and expect the outcome you want. So having detailed plans can help you focus your attention when a challenge arises. Take risks when it doesn't work out. And it doesn't have to be, some big thing, right? It can be just as little as, trying to put yourself out there and answer more questions in case conference, even though it's really uncomfortable for you to do that, and you're kind of scared to talk in those group settings. But remember that if you're always just sitting there comfortable in what you're doing, that you're probably not growing or learning as much as you could. And connection is my favorite one because it has been a huge part of my wellness and resilience. Throughout my training, I've made really great efforts to build connections with people and develop deep relationships with them. I've made friends who are family, for whom I would truly go to the ends of the earth for. So in every step of your journey, for your sanity, for your wellness, I really encourage you to find your people who are going to be honest with you when you need to, and then support you when you need that unquestionable support. So in summary, I will say, the thing about resilience is not being surprised that bad things are going to happen, right? Life is unfair. If you think that life should always be fair to you, then you're really just setting yourself up for disappointment. Life is hard. Share the wealth of what you have learned from failures with others. I remember thinking, when I first became a mother and like a working mom, I was like, this is insanely so hard. Like, why hasn't anyone told me this before? Everyone made it seem like it was just so easy. And like, I'm coming into work with like 2 different pairs of shoes on. Like, I am like not a highly functioning human being anymore. But I never know, no one ever told me how hard it was. And I don't think that that's right or fair, right? If you have this sort of, if you pretend that you just got here on your golden carpet and you're sitting on your golden carpet as an attending, you perpetuate the feeling of imposter syndrome to those behind you. And certainly people are not going to find you very relatable, because if you think you're perfect, then, who do you think you are? And then, just because people are people, when you fall, they're always going to love a really good show to watch you fall. So, my advice is to keep your feet planted on the ground. It's a really safe place to be. And grits is not something that is just useful in residency or fellowship. It is a forever thing. I think that training was, one of the easiest parts of my life. Yes, it was stressful. Yes, there's a lot of powerlessness and a sense of, lacking autonomy. But, now I have to keep 2 other human beings and a dog alive. And so, training is long, but it's 7 years out of 30 to 40 years that you may be practicing in medicine. So, grit will serve you well. I promise you that. And then finally, resilience. You can always make failure better. Resilience is not about just standing up, back up when you fall, but it's also recognizing, when you need to pivot and when you need to ask for help. That's it. Thank you so much.
That was really incredible. Thank you. My question was really going to ask how you build a support system and how you find people that can really support you, and how you've done that in your career. But you really kind of answered that right at the end. I guess my question is, so you have those people around you. I guess my question is, if you weren't in academics, or how do you really find those people? And have you found that mostly it's family or outside of work that those people are there for you and supportive of failure, or you've found mentorship and people at work that have been able to be a support system as well?
That's a really good question. So these relationships are something that I'm actually very proud of, because people are always surprised because I'm pretty gregarious and seemingly extroverted, but I am truly an introvert at heart. So for me, it was really working. Like, for me, I'm a very honest, kind of direct human being, and I expect my friends to be that way as well. Like, they tell me things when I need to hear them, even though they're hard to hear, right? You need friends like that, because you don't want people to say like, oh, you're so great, and that you have no sense of self-awareness at all, which I think is a very dangerous way to kind of go through life. The other thing is, I have most of I would say my validity in life doesn't come from work. Yes, I love work and I have pride in my work, but my validity comes from my friendships and from my family, and they defined, who I am. So that if I were to lose my job tomorrow, yes, that would be really awful, but I would survive because that doesn't define who I am. But yes, mentorship for sure. People, and you need to have various depths of relationships with people, right? You need to have someone that is going to be your cheerleader, people who are going to really tell you honest things when you need to hear them. And there's going to be superficial ones, and then there are going to be the much deeper ones. And the thing I always say for people who are faculty members in academic medicine is you kind of have to be careful about how awesome you think you are, because, you know, like medical students and residents and fellows kind of have to like laugh at your jokes and have to pretend to like you, even though they might not like you. So your likability may be not as great as you think it is, right? Versus in private practice, it's not like that, right? Especially for radiology, which is like a service, which is a service specialty where you kind of really have to make really good connections with people. So it's just about sort of situational awareness and just trying to really sort of gain insight with yourself. And that really takes a lot of reflection, I think.
Okay. Thank you. So we actually have a few questions in the chat, so I'm going to just go ahead and read them for you.
Okay.
So Alex Kuzansko says, thank you for an amazing webinar. How do you find the courage to share your failure with others? It's a good question.
Oh, yeah. I would tell you because I always am, I don't know, I'm a hot mess all the time. I even told like one of my residents, I even texted her late last night. I'm like, it's a webinar tomorrow at 7, because I'm the person that shows up in the wrong day at the wrong time at the wrong party all the time, like a hot mess. I'm like, I always say I'm like Dory the fish, right? But I also share my mistakes and misses with the residents. Yeah, it sucks the first time you do it, but I'm like, this is a learning opportunity. I missed this infarct, like, and so why did I miss it? Let's look at it again. This is something, we all make mistakes, right? And I will say it's so much better to do it that way, because the thing about radiology is that your mistakes are in black and white for posterity, right? So it's much easier to say, here are my mistakes, let's learn from them and talk about them all the time, instead of being like, oh my god, I am so smart, I can't make a mistake. Because when that mistake eventually comes, people will say, oh my gosh, she made a mistake. And you don't want that, right? You just like here, and you want to share what you have learned so that other people don't make them. And then for me, I hope, I don't know if it works, but I hope that by sharing my mistakes and saying like, listen, I try my best, but I'm making mistakes too, right? And we all do, that they don't feel the pressure of being like so perfect on call and like not being overcome with anxiety. Yes, you should try to be great and you should try to be awesome on call, but hopefully you won't be so overcome with anxiety, because that even attendings make mistakes.
Right. Okay. That's so interesting. It's so true about radiology. Our mistakes are there forever, and it's like
Yeah, it's
every
awful.
I'm like, no.
I know, it's awful. You're like, who read that? You're like, oh, I read, I read that report. I read that study. I mean, it's awful, and it's a humbling experience. But the whole thing is about not having paralyze you and learning from it.
Definitely. Okay, we have another question. So this is from Hannah Myers. She says, do you have any recommendations for dealing with the amygdala response you get when you're nervous? So I think she gave a few examples, as in doing a difficult biopsy or answering an unknown question in conference. And I think you gave a really good example about how you used to feel when you took cases in radiology conference.
Awful. It was awful. I remember when I first, actually, when I first started giving residence conference lecture, when I first started as a resident, started as a faculty member, I would take propranolol. Like, it was just this thing, and I've always had it. So there's a couple of things. One is, this is like probably not the answer people want to hear, but meditation like I really should be like the poster child for meditation because I have like mad ADHD and I'm like I like run through life like at 150 miles an hour. So, you know, when you think about meditation, you think about people being like really slow and wearing the orange robes and the beards and that kind of stuff. But it's really not like that. I listened to the audiobook, don't read it, the audiobook of 10% Happier by oh my God, I forgot his name, Dan Harris, who was a, you know, news correspondent, whatever. He felt the same way. And what I really liked about that is when you meditate, it's the exercise of learning how to respond and not to react, right? So how many times when, you know, when something had happened, I'm very quick, like I'm like an angry person, right? Where you know, and I can react very quickly and you're like, oh, good, shouldn't have done that. And how many times I've wished like, God, I wish I just stopped and was able to respond to the situation instead of like reacting on very primitive things. And the meditation part kind of helps you with that a little bit. But if you don't want to do that, which is totally understandable, I think, yeah, you know, you just have to make the mistake. And I would tell this medical, just put yourself out there and keep on messing up, and you'll realize it's all going to be okay. Like you could do the dumb things, you could say the dumb answers, you can kind of not do the biopsy well. But if you keep on messing up, you realize that the life is not going to fall apart. People are not going to think you're terrible. Your head's not going to fall off. Like, so get used to it. I just got used to making a lot of mistakes and realizing there is absolutely no consequence at all whatsoever from it.
I do think it has to do with practice as well. I'm terrified of public speaking, absolutely terrified. And taking cases and also presenting cases in IR, we have like case conferences where we present cases. And for me, that was just like terrifying. And then I sort of made myself take more. I made myself present to SIR Andrew Club, which was terrifying, but I'm a lot more comfortable now doing it. So,
Yeah, right? You
but
put yourself out there. It's really uncomfortable, but you're putting yourself out there and you realize even if it didn't go as perfectly as you wanted to, it's still okay, right? It was a good experience from it.
yeah, okay. I have another question. I actually got this as a text from someone watching. Um, so he said he's wondering about how you think we can make the feedback process better, both as people giving and receiving feedback.
That's a great question. I think there has to be a compromise from both places, right? I think from the attending side is learning um, how to give feedback. It's very easy to give as a faculty member. It's very easy to give like you did great today. I'm sorry, it's my dog. Steven. That's my dog. Obviously, not my children. Um, Steven. So I find that faculty members find it extraordinarily difficult to give constructive criticism, right? Because they really like the residents and they find it very difficult and mean to they find it mean, right? And they find it difficult to separate like how they like the person versus giving the constructive criticism because they feel like if they give the constructive criticism, then the resident is going to take it as they don't like them and they don't want that to happen. So then they're like, oh, everybody's great, everything's great, everyone gets fours, you know. And then, but me as a program director, like I can't do that. So I'm the messenger of the bad news, right? Where I'm like, well, you know, actually, even though those are all the evaluations that you got are great, you know, actually your fund of knowledge is probably not, you know, so then it's like, what are you talking about? So people need to get better at that for sure. The other thing is that residents also need to realize that feedback comes in so many different ways while you're in residency. It's not just like at your semi-annual review. It's not when an attending says, okay, now I'm going to give you feedback. right? It is all the time. It is when you are, reading out with them a one-on-one, and they are going over the case with you and asking you questions. That's feedback and testing you how much you know. They're giving you feedback on your report. In case conference, you're not getting it right. That's feedback. There's so many different ways, and all the time people are getting, feedback. So you have to be aware of that and then open to it. And then realize there's also sort of like, if I'm asking you questions all day, and pimping you on all of your cases, and you are not getting any of the questions right, you should kind of have some sort of like self-awareness, some sort of wherewithal to say, I am not getting any of the questions that Dr. J is asking me. So maybe I should read a little bit more, right? So there's also the need for self-awareness as well.
Okay. Okay, a few more questions. We have a little more time. So Jeffrey says, thank you so much for sharing your experience with us. I'm in my second year in med school and want to pursue IR. Being in academics, who do you consider a competitive student for residency?
Oh, that's a really good question. So I like to look at things I try to look at things in a holistic way, right? Because if you can't sum up a person on grades and board scores, right? Because you could sit there and study all day, every day, and that's the only thing you did, and just rock out school and rock out the boards, right? But if you're the person who is giving up that opportunity cost to do service work or to work on like a passion, like, you play cello for your national, like the symphony, your local symphony or something like that, that takes a lot more time away from studying. So, I look at that. That's going to be a well-rounded human being. And, communication is extraordinarily important for radiology. Not obviously in IR because you're talking to patients, but also in DR when you're dictating reports. And so if you can't get your thoughts across clearly or you can't speak to, clinicians, that's an issue. So we like to look at that. And I would much rather, like I said, I really like grit and hustle. I really have a soft start for people who have shown grit and hustle throughout their lives, because I think that is the one thing that really predicts success and thriving in residency, because it's hard, okay? If someone who sits on their laurels because they're just awesome standardized test takers and just kind of don't work that hard, I'd much rather have the person who got, 230 on their boards instead of 260 and sitting on the laurels. Someone who's 230 on the boards and, hustling because they always want to be better. That's much more teachable.
And I don't know if you know Dr. Nolan Kagatsu.
But Nolan.
He says that feedback is the other F word.
Yes, there's a lot of F words. Feedback for sure.
So I think that's all of our questions.
Wonderful.
Thank you so much again. And I'm sorry for
Thank you so much. That was okay. I appreciate so much for the opportunity to talk. It was great to talk to you guys.
Really, really an honor to have you. Thank you.
Thank you
guys so much. All right. Bye.
Bye.